So, just going to go through something that I do sometimes to show some of the things that I'm looking at and where they started from to try to understand something better, whatever it happens to be. So, this will eventually turn into an Osteopathic Lyceum podcast. But I was filming a course for a colleague who was talking about treating scoliotic patients. Or was it? No, sorry. She was talking about treating hypermobile patients. So she was speaking to Ehlers-Danlos syndrome, Marfan syndrome. Uh, I think she spoke a little bit about postural orthostatic tachycardia syndrome, so POTS, and she was talking a little bit about MCAS, mast cell activation syndrome, and how there's some co-occurrences. And she made a specific note of a fuzzy body map. So it seems as though in what she was presenting, people with Ehlers-Danlos have a fuzzy body map. Now, what that did was that sparked the idea in me to consider, because Ehlers-Danlos does seem to be autoimmune. So I had looked up initially Ehlers-Danlos and personality disorder, and I found some research. It doesn't necessarily say that there's a chronic co-occurrence of those things. But then what it did is it pulled me out a little bit and said, okay, well, what about autoimmune disorders? Is there something going on with autoimmune disorders and the possibility of personality disorders or psychiatric disorders? So I'll zoom in on this so that you see. Okay, hold on. Will it focus? Will it focus? Will it focus? Focus. You're not focusing. Come back here, see if it'll focus. Hold on. Come on. Focus on something. Okay, so there we go. Damn it. There we go. Autoimmune disease and personality disorders, right? So this is a Google Scholar search, autoimmune diseases and psychiatric disorders. And when's that from? That's 2019. We've got autoimmune diseases, bipolar disorder, non-affective psychosis from 2010. We've got personality disorders and emotional variables in patients with lupus, and that's 2007. Psychiatric manifestations of autoimmune disorders, 2005. Mood, anxiety, and personality disorders in patients with systemic lupus erythematosus, 2013. Borderline personality disorder and thyroid diseases, a Mendelian randomization study, 2023. Split personality of NKT cells, that's about the cells, that's not about people. Causal relationships between mood instability and autoimmune diseases, a Mendelian randomization analysis. Now, I looked at this one, and I think what it was showing was, I think the highest relationship was asthma between mood instability and autoimmune disorders. So asthma was strong. That was 2023. Association between panic disorder, major depressive disorder, celiac disease, a possible role of thyroid autoimmunity, 2002. So there's something going on whereby there is research building in this area. And the reason that I formed the question was because when my colleague talked about the fuzzy body map in people with Ehlers-Danlos, it led me in my semantic network, or my network of related meaning, to consider the theory of constructed emotion and how higher levels of uncertainty about signals in the body or in the world seemed to relate to more negative affect or more negatively valenced emotions. Like, emotions isn't the perfect word, but it's essentially more negatively valenced affect or more negatively valenced interpretations of signals. So the fuzzy body map essentially started me thinking that it's at least possible that people with autoimmune connective tissue disorders may have greater levels of uncertainty about body position, and that could then impact how they present in the world in relation to other people. So I also heard a term that somebody who is a very, very strong psychologist say, that essentially psychology is biology. And if you don't think so, you don't understand either one well enough. Now, I'm not going to comment specifically on the veracity or the validity of that claim, but we got a bunch of stuff here that seems to show that there's the possibility through investigation that we could see a relationship or we could not. So far, it seems like we're seeing some relationship between internal physiological states that are autoimmune and some form of related expression external in the social and cognitive and emotional sense. So there might be something going on here whereby some of the common presentations that we see with autoimmune connective tissue disorders will impact some social, some cognitive, and some emotional stuff. And then you can sort of, for my sake, see why some people would say things like, biopsychosocial model, and then I have my critiques of that. But maybe the reason, or maybe a prediction could be that they're more likely to turn to that terminology and that worldview in relation to possibly themselves having some form of autoimmune condition or some sort of soft tissue condition where they have higher levels of uncertainty. Now, it's not to be dismissive, but it's to say that there's a relationship that I'm at least considering and show you sort of what it looks like when I do that. But that's that's damn near 6 minutes of telling you about that while looking at this. So thanks for listening this long if you did. You're a champ. Now for another piece of mundane, in order to make sure that students are hitting appropriate targets with respect to patient encounters when being trained, I was tracking myself, so I was essentially keeping track of all of it on centralized documents. But what I've done for the new students who are coming in, you'll see this, we've got the patient number, date, assessed, treated, signature, or supervisor signature. So to make sure that in clinical encounters that there's multiple levels of redundancy and supervision and that they hit a total of 50 patients, had to create a new document. So yay, how fun. Also, what I'm doing is for the students, I'm adding in the opportunity to appropriately track shadowing hours. Now, with respect to a lot of the international documents that make suggestions as to how to train osteopathic practitioners, they do note that clinical supervised hours can include shadowing other professionals. So it obviously would include shadowing osteopathic manual practitioners, but you could shadow somebody such as a physiotherapist or a medical doctor, as long as they're willing, able, and they, at least in this case, they have to contact the school, make sure that they're acknowledging that they're going to shadow a student. So we've got to have some level of redundancy and tracking. But running a school, you want to make sure that people are doing things above board. You got to create tracking sheets. So as many of you will know, I am not a lover of administrative tasks, but this is what it ends up looking like on a blank sheet when you're adding things in so that people have the opportunity to take advantage of a variety of clinical opportunities. So we're back with the really simple stuff. Just take a simple, quick look at the room. Trying to set things up stumbling over my words like a goof. Setting things up slightly differently in the room to try to make slightly better use of the space. So this may not look like much, but the tables are angled in the attempt that when people are at the head of the table or the foot of the table, it's just a little bit easier to get around because we do have to be somewhat modular. We've got small storage stools that students can sit on. We just change things like the angle of the tables to try to utilize the space slightly better. Also, I did get a new vacuum because the other one, the swivel head had broken. But yeah, we got a new vacuum. So good old mundane stuff that I'm sure everybody loves. And obviously I'm saying that with sarcasm. So whether or not everybody loves it, the aim of this is to report to some degree some of the really, really basic everyday things that happens when you're trying to deliver education to people. So it's like we've got the curriculum, we've got all the kind of big interesting stuff, but we also have the mundane stuff that makes a difference in the ability to maintain a reasonable space, keep it clean, and then somebody accidentally, when using the vacuum, breaks it through no malice, and then you got to get a new one, and then for some reason report it to the world. So there you go. So one of the things that the students give me a bit of a hard time about is the fact that I happen to speak about a friend of mine often. The students apparently take bets on how fast I'm going to talk about Ben Johnson. Now, the reason I'm putting this in here is twofold. This is going in the vlog for the Osteopathic Lyceum. So it's not really about the school. The only connection is that the students give me a bit of a hard time because I do talk about Ben. He ends up being a reasonable example or analogy for a lot of things. I can utilize knowing him with respect to, say, physical capacity as well as treatment, because I have had the opportunity to work with Ben. Obviously not in his prime, because I didn't know him in his prime. But anyways, there's something that I was watching, and I want to make this a little bit more timely. So I ended up watching an interview with Stuart McMillan, and it was on the Huberman Lab podcast. Now, I have never met McMillan. I definitely have never met Huberman. But they were talking about Ben, and one of the stories that's gone around a lot about Ben. So I'm not saying anything negative about the fact that Stuart, or Stu, however he is more appropriate to address him. I don't think he said this with any ill will, because it's a story I've heard a ton. Now, I'm going to tell you that this story came apparently first from Charles Poliquin, who has unfortunately passed away. Very influential, did a lot of stuff, and some people love him, some people don't like him. Poliquin told the story that some former Russian athlete said that Ben squatted a very heavy squat. I think it was claimed around 600 pounds, or at least that's what Stu says, and that was utilized for potentiation. So Stu said he heard Ben had squatted earlier in the week. Some people say that Ben squatted between the semifinal and the final, and so I'm going to let this play. This is a project that I've been working on for a little while. I have the opportunity to talk to Ben and get him to tell stories on his own, because people talk about Ben, but they don't talk to Ben. So I'm going to keep this looking this way, because when I end up posting this on Ben's behalf, I don't want the opportunity for any copyright strikes, because this will definitely be on Ben's channel in the future. But this is just me trying to get a little bit of ahead of it, and also provide a bit of a teaser if anybody ever looks around. So if you've made it this far in this vlog video, you're getting something ahead of another form of release. So I'm going to play this, and hopefully the sound goes okay. So I'll turn it up. Between the semifinal and the final, there's a bunch of stories that go around. Okay, I want this is personal, because I've heard too many people say this. There's a story that goes around that between the semifinal and the final, you did a heavy squat to help you run faster.
No. That was bullshit. No, yeah. Never happened.
There was no weights.
That was early in the week. I bench press.
You bench pressed heavy.
I bench press about I think it was like 425,
You've said 450. You said
about 425, 450 around that area.
You said
some say it was 475.
Yeah. Okay, so hopefully that got picked up on the microphone okay. Ben did not squat heavy the week of running in 1988. He did not squat between the rounds. He napped between rounds. So he napped between the semifinal and the final. And his coach, Charlie Francis, was very frantic about it. But that's just how Ben was. Anyways, as this comes out, some people will find this, some people won't. But I just want to put this out ahead, so there's the opportunity to make it a little bit more timely in relation to the conversation that Dr. Huberman had with Stu McMillan. And again, there's nothing negative to be said about that conversation. It's just that I happen to have information and access that I value a lot, because Ben's a friend of mine. So students who are watching this, yeah, keep giving me a hard time about it, but at least I'm telling the truth.